what are we looking at here?
Healthy skin.
And can you just kind of orient us to, like, I mean, it's kind of a cross-section of flesh and bone, but can you orient us to?
Yes, so the first layer that you see with the hair follicle coming out, that's the epidermis. The next layer down that has some veininess, or where the hair follicle actually is considered the dermis. Those are the two upper layers of the skin. And then below that, you're going to see subcutaneous fat. Below that is muscle and fascia, and then below that would be bone.
All right. And then just we're going to go down the line. So that's healthy skin. What are we looking at here?
That would be a stage 1 pressure injury.
And you see the photograph, but just generally, can you kind of tell us what a stage 1 is?
Sure, it's a reddening of the skin that's non-blanchable, and there is no opening in the skin. It's a redness to the skin that's non-blanchable, which means if you touch it, the white, if you touch the area, it stays red. It doesn't recirculate. Blood doesn't recirculate to the area.
And I guess from the photograph, is there some damage under the outer layer of the skin?
To the top 2 layers of the skin, the dermis and the epidermis.
All right. And then what's the next stage 2?
Stage 2 would be a superficial opening or an actual break in the skin. So you see there's a break in the epidermis on the top, and sometimes it can go all the way down to the dermis, the top 2 layers of the skin.
All right, how about stage 3?
Stage 3 wounds encompass the top 2 layers and can go all the way down to the subcutaneous fat.
And then stage 4?
Same, goes through all the top layers, through the subcutaneous fat, and breaks into the muscular area and fascia, and will be down to the bone.
Is stage 4 the most severe?
It's the most severe pressure ulcer. Yes, pressure wound.
Okay. And then this one, how about this one? Unstable?
Well, what we consider an unstageable wound is basically a wound that has scab formation at the top, as this is demonstrating. So you can't really see the different layers or how far it deeps just from visualizing the wound. So it has to be considered unstageable until this is cleared, where you can actually see how deep the wound goes.
And how do you typically clear away the debris?
Some medications can debride that or take that away, or a lot of times it's done manually by a physician or a physical therapist, where they just debride that area and take that superficial scabbing off.
And we're jumping to the end, but you did review the Miss Reed's hospital records for the hospital report.
Yes.
And when it was photographed or described in the hospital, was it this stage?
Correct. It was an unstageable wound.
Okay. And then was there debridement done?
There was.
And then what stage was it?
Stage 4.
This stage?
That's correct. Okay. After they cleaned it, debrided it, this is potentially what it looked like.
I've retained you, we've retained you to review records in this case, yes?
Yes, sir.
What records did you review?
I reviewed the Florida hospitals prior to Mrs. Reed coming into Life Care Center of Orlando. I reviewed the records from Life Care Center of Orlando, and then the post residency hospital records that were also at a Florida hospital. I had looked at some photos along the way that were provided to me, and then also I reviewed the records from the orthopedic and trauma physicians that were treating her fractured leg.
How about depositions? You reviewed any testimony?
I did.
What did you review, just so we can get an understanding of your base knowledge?
Sure. Several of the nurses at the facility: Angela Asher, LPN; Consuela Fisher, LPN; Patricia McCann, LPN, and
Jason Sal?
no, Makila.
Nurse Magdalene is what?
Is it Magdalena? Akila, okay. She's a registered nurse. Sorry, it's a difficult name to pronounce. And then also the physical therapist, Jason Sayo, is that correct? And the occupational therapist, Jessie Malari, Mrs. Reed herself, and then physician Dr. Segnitius.
And after reviewing the records and the depositions you listed off, did you develop a nursing manual?
I did.
And what we're going to do is just have you tell the jury generally what those are, and then we'll go break it down and look at some documents. Can you tell them what two things you developed?
Well, my primary opinion is that they failed to provide Mrs. Reed with adequate and appropriate health care. And to break that down, they failed to develop an adequate care plan that addressed her high risk for skin breakdown. They failed to implement that care plan. And then they failed to revise that care plan once this skin tear developed and then eventually developed into some type of a pressure wound. They also failed miserably at addressing that skin wound or skin tear when it was identified initially on 1024 by therapy. They failed to follow some of the physician's orders, which I believe we're going to go through. There was poor, in my opinion, there was really poor communication in the nursing staff or through the nursing staff. We'll talk about that a little bit. I thought the therapy group did a fantastic job of identifying some of these, but in my opinion, they fell below the standard of care with the lack of communication within the nursing department. And then lastly, they failed to perform or document any description of this wound other than that it was a friction shearing wound throughout her entire residence. Occupational therapy described it as a skin tear, but nursing listed it on a document as friction shearing and then never provided any other type of documentation of what the wound